Okay, go for gold. Okay, good evening, good afternoon, everybody. Welcome to my HCPC Standards webinar. This is Standard 8, being open and honest when things go wrong. It's one of our series of webinars, just to say that they are all available, they are all recorded, and you will be sent all the links to them. So please don't worry that you're going to miss everything. So they will be there if you need them. So we've got a nice session planned for you today. So let's start, if that's okay. The session is going to be about 50 minutes long. This is what we're going to cover, a very brief cant around the HCPC role and standards, looking mainly, though, at Standard 8 being open when things go wrong. There will, as you know, be a certificate at the end, an evaluation survey. We'd be really grateful if you'd complete that, because, again, it really gives us help with what we're going to do in these webinars. And my colleagues will be monitoring the Q&A chat, so there's a chat box if you want to say anything in the chat. You're very welcome to, and we will respond to those questions if that's a help. And I think that's most of the sort of bit about it, really, to be honest. So we've got a really exciting thing tonight, because we're actually joined by Dr. Vince Clark, who is a paramedic, senior lecturer and programme lead at University of Hertfordshire. I'll let him say hello in a second, but my name's Kim Tolley. As you know, I'm a professional liaison consultant at the HCPC and a nurse by profession. So Vince, would you mind saying hello, please?
Hello, yes, I am the programme lead at the University of Hertfordshire, and I've been an HCPC partner for many years in education, CPD and fitness to practice as well.
Well, Vince, we're really grateful for you for giving up your evening, your late part of the day to join us today, particularly with all your expertise on the front line as a paramedic. So really appreciate that. I'm also joined by a couple of my colleagues. So Grace, would you say hello?
Yeah, hi everybody. My name is Grace. I'm Senior Policy Officer in the Policy and Standards Department at HCPC.
Thank you, Grace. And Holly, who's going to be monitoring our chat and also has been responsible for sending out all the emails to you. Holly.
Yeah, thanks, Kim. Yeah, my name's Holly Butler. I'm the Events and Communications Officer at the HCPC, so I work within the communications team and help organise a lot of the events that we do.
Thanks, Holly. And Kelly, who's the lead of the Professional Liaison Service.
Yes, hello everyone. My name is Kelly Green. I am the Head of Professionalism and Upstream Regulation at the HCPC. We're delighted that you can all join us this evening, and I've just noticed someone in the chat box saying hello and good evening from India. So very welcome to everyone from India this evening.
You're most welcome. Thank you for joining us.
Thank you.
We're a team, and we're going to hopefully deliver a really nice session for you in the next sort of 50 minutes. Bit about GDPR, we always have to say this, but remember that your name will come up in the chat box. We are recording this webinar, so just to remember that, really, and any comments that you say in your evaluation survey, we will be using in our marketing material, which is always really useful. So you'll remember how it plays off here. We always have these questions to start with. So without further ado, I'm going to ask you to tell me, and I'm sorry I'm looking down at my phone when I do this, as you know, I'm going to ask you to tell me to log on to Slido. So you can see there it says slido.com. If you go onto that website, you don't have to put your name in, you don't have to put any information in, but it will ask you for the hashtag MyHCPC Standard 8. And when you get the hashtag, you can then vote and let us know which profession you belong to. Oh, there you go. Vince, I think you've pulled in some paramedics tonight, so we've got a paramedic there, which is really nice. And again, it's super useful for us to see who's around in these sessions and to get a bit of an idea. We're really delighted that Vince could join us today to talk to us a little bit and apply the duty of candour and being open to the paramedic service, which is really nice. So as you know, this does take a few minutes to do. I do apologise for the fact that it goes up in the ether and back down to the ether and back down to us, but sometimes that just happens, and that's just life. We just have to cope with the little bit of a delay that this actually has. So thank you. That's giving us a real idea. We've got mostly paramedics and physiotherapists with us tonight, and a few occupational department practitioners. So thank you very much for that. I'm going to move on to my next question, which is always the same, but it gives us a real idea of how your thoughts about us are changing over time, and that's really useful. So when you think of the HCPC, what word comes to mind? That's just really helpful for us, just to see what word comes to mind. And how you think about us. We are regulators, thank you for that. We do deal with registration. That's a big part of our role is registration and dealing with those sort of issues. while we're chatting about this, just to let you know that there's an employer newsletter due to come out in the next couple of days. So we're always trying to think of ways to engage with you to let you know what's going on. We're hoping that we are informative. Hopefully we are supportive to you as well. That's really important. Lovely. Thank you for those words. They just help us to find out what you think about us. And again, we've talked a lot about this before, but we are there for patient protection and we are there to support you being professionals. So thank you very much for that. Fantastic. So without further ado, I'm getting quite a few more questions, quite a few more answers on my phone, just to say, but they take a while to get to the screen. So I do apologise for that. OK, and my last question, I'm going to do it now instead of a bit later on, but we're going to look at Standard 8. So do you know how many parts there are of Standard 8 and how would you rate your knowledge of Standard 8 of the HCPC Standards of Conduct, Performance and Ethics? This gives us a real idea of where you are in your understanding and about the standard, and there's always a disparity, isn't there? Because we may have some students on the line, we may have lots of people who've been qualified quite a long time, so there's going to be a difference, isn't there, between knowledge and stuff, and that's absolutely fine. So fantastic. Sorry, so excuse me. OK, let's look at our standards and guidance. We've seen this slide many times before, so I'm not going to go through it in any great detail, but just to say the most important things at the moment are the standards of proficiency, which are being updated, a new lot coming out fairly soon, which we'll be doing some sessions on, and also our standards of performance, conduct and ethics, which you can see down there. Excuse me, I'm just going to go on mute while I have a cough, so that's awful to say. It's very rude. OK, so we're going to look at Standard 8, which is about openness. As we've already said, we're going to work through those. The next two after this are about honesty, professional behaviour and record keeping. So 9 and 10 over the one later on this month and one the month after. So we'll be doing those for you. So that's what we are covering in our webinar. So Standard 8, being open when things go wrong. This is really two parts to Standard 8. We're going to look at both those parts. The first bit is openness. I always link openness and honesty, but actually we're going to cover honesty in particularly in Standard 9. But it's about being open with service users and carers. And the part 2 of the Standard 8 is actually dealing with concerns and complaints, which we'll look at as well, because that's a really big important part of Standard 8. So these are the main parts of Standard 8.1 are really about informing a patient when something goes wrong. But not only that, but apologising. And this is what we're going to cover quite a bit about today. Taking action, giving the patient a prompt explanation, but also thinking about how we can prevent that happening to somebody again. So looking at learning, looking at reflecting on mistakes as if they've happened and trying to prevent them happening to patients again. That's really a big part of Standard 8. And I just thought I wanted to start really. We're going to look particularly about the professional duty of candour, but just to let you know, and I know lots of you will know this, but there is a statutory duty of candour as well. So there are two parts of the duty of candour, and really, as your regulator, we're most interested, and we write a lot in our standards about your professional duty of candour. So that is what some people would see as a common sense approach to duty of candour, so being open when something goes wrong. But there's also the statutory organisational duty of candour, and that talks about the treatment or care, and that comes into play really when the treatment or care of a patient provided to a patient causes death or a serious injury or a notifiable safety incident. All right. Now remember that the statutory duty of candour is not available in all across all of the UK, whereas the professional duty of candour is available or is used across all of the UK. Right in the centre there, there's a PSA report. The Professional Standards Agency did a report in January 2019, and it looked at how its regulators, what our responsibilities were in relation to duty of candour. So it was quite a good review of where everybody sat with duty of candour. I think they made the point that actually sometimes the two get conflated, and actually it causes it's not very helpful when things get conflated. So actually it is important to make that distinguishing feature between the two of them. So just to let you know that a lot of the research now shows that they're actually very well embedded within healthcare practice, but we thought it was a really good opportunity, even though they are embedded in healthcare practice, to sort of remind everybody of some of the key features of that. And as I said to you, we're very lucky because Vince is here, and Vince kindly in July 2019 wrote a really great blog on when something goes wrong, openness in everybody's best interest. So I'm going to actually hand over to Vince because he's going to talk a little bit about some of the key things that he talked about in his blog. So would that be okay, Vince?
Yes, that's fine. Thank you, Kim. Yeah, so when I put this together, I've been asked to think about the culture within the ambulance service, and it was on the back of the fact that there was a very high proportion of self-referrals coming from the paramedic professional group into the HCPC for fitness to practice matters, and they were areas that at the time really shouldn't have been being self-referred. And it was something where the organisations, the employing ambulance services, didn't really understand the role of the HCPC as a regulator. And in the very early days of the HCPC, they appeared to be using it as a bit of a big stick and threatening staff with the HCPC and saying, we'll refer to the HCPC, not really understanding. And that had certainly improved by the time I put this blog together in 2019. But it was certainly the culture that was in place within the ambulance service, that it was something of the HCPC was there to enforce the rules, and it was the big stick approach. That's changed quite considerably now, and people are much more understanding and aware of the role of the HCPC as the regulator, and that was reflected, I think, in the nature of cases that I used to review when I was on fitness to practice panels, and the type of cases that were coming through for review, where they really shouldn't have been coming to those initial panels, and then we were having to send them away because they weren't things that we would be dealing with as a regulator, and the employers shouldn't have been forwarding them to us. So trying to make the individual professionals, the individual paramedics in my case, aware of how they can manage situations when they go wrong and how they can be best supported by their employers and the HCPC was quite important at the time. And one of the key things that we try and encourage is openness, honesty, and demonstration of insight, and that's across the board as a regulated professional. And if something goes wrong, to effectively put your hands up, recognise that something's gone wrong, accept responsibility for it, and in relation to the duty of candour side of things, apologise where appropriate to the patient who's been impacted on. That's something that, in particular in the paramedic world, is particularly challenging due to the nature of the incidents that we go to, where often they're time critical and we're acting in very rapidly changing environments. And sometimes we wouldn't know that there's been an adverse incident until after the event, and it wouldn't be incumbent on the actual paramedic to apologise face to face to the patient because they might not recognise the impact of something that's gone wrong in those circumstances. But when they are able, and when it's appropriate, it's important that any professional recognises that something's gone wrong and apologises in the first instance and doesn't try and cover things up. And I think that's one of the key things that we found from fitness to practice hearings is that aspect of insight and honesty and integrity, where a lack of openness results in somebody either trying to cover something up or not bringing it to the fore. And when it is uncovered, that causes a big problem for those individuals. So being upfront, honest, and in your communications, both with patients and with organisations, is key to not only meet the expectations of the regulator for your duty of candour, but also to maintain a professional relationship with your organisation and your patients.
Yeah, thanks, Vince. I was just going to ask you, Vince, because I think that what is a really good point you make, that it's easier to be open when it's happening straight in front of you. But as you so rightly say, the patient's dropped off to hospital. You may not know that something's gone wrong, mightn't you? It makes it very complex for paramedics, doesn't it? Yes,
yeah, it does. And that is an evolving situation within the profession. So we are, as a profession, working in lots of other environments now. So this type of matter is going to start to raise itself in different settings. So working in primary care, in GP surgeries, in hospitals, and various other private settings as well, where the interaction between the paramedic and the patient is likely to be longer lasting and perhaps repeated. So there might be more opportunity for apologising and for recognising mistakes and contacting a patient in those settings than there would be in the current frontline accident and emergency, out of hours emergency care type settings. So it is changing, and it's something that professionals need to be mindful of as they develop within their profession. Yeah,
thank you, Vince, and thanks. Those are really important points you make, and the importance of not covering up for me is one of the big ones, really. So being open and very honest when something happens. Yeah,
and that's certainly something that when, again, going back to the potential ramifications of this type of matter, is a fitness to practice case, and one of the first things that I would advise any colleague is to, if you've made a mistake, then acknowledge that and try and do something about it, and that makes a huge difference at a fitness to practice panel hearing to demonstrate that insight and that remorse and that apology. So hopefully you wouldn't even get to a fitness to practice case on the basis of following the appropriate pathways within your professional body.
Brilliant, thank you, Vince. That's fantastic. So that's really helpful, and a really lovely summary of your blog. I'm going to ask you also just to take, we've got 3 case studies, so if you don't mind, I was going to ask you to take the first one because it's a paramedic. So let's go to the first case study, if that's all right. So we've got Abdullah, who's a registered paramedic, and he's gone to a call with Mrs. French, who's had a fall at home, and he's greeted at the door by Mr. French, who said, "What took you so long? My wife's been stuck on the floor for 2 hours now." I'm sure this is a situation, Vince, that you can identify with, something that's very common. Somebody getting angry with you because they've been waiting desperately for the paramedics to arrive. Yeah, so I'm sure it is.
Yes, a very common occurrence. And I think when I talk to paramedics about this, it's just to remind the paramedics that this might be the 100th time it's happened to them, and it might be the 3rd or 4th time it's happened to them that day. But from a patient perspective, it's the first time it may have happened to that patient, and it's a new experience for that patient. And sometimes you can, undertaking your professional role, going from incident to incident, you can start to forget the actual impact that incident has on that patient, and how your behaviour and how you interact with them can influence the entire patient contact. So I think it's a challenging situation. It's definitely a familiar situation, and there are various different ways that myself and colleagues might approach it. And I think the easiest thing to do is to, particularly in a delay situation like this, the easiest thing is to say, yep, I'm sorry, we've been delayed, it's very busy, or the call volume is very high and your case wasn't a priority. And the trouble with some of those comments, which would potentially be absolutely true because of the nature of the incident, it might not be a high priority, but that's not something that you really ought to be saying to a patient who has been waiting for an ambulance and expecting help, to categorize their need below somebody else's. Although it's factually correct, it doesn't actually help the situation, it doesn't help the patient, and it doesn't help your interaction with the patient on that occasion. So although that's something that is comfortable to say for the paramedic, and to try and rationalize why they're late and give reasons for that to the patient, that's probably not the best thing to do from a patient perspective, because it doesn't actually help the patient, and it doesn't do anything to enhance the environment that you're working in relationship to the patient and in this case the husband. So I think the best approach would be to apologise and to say, I'm sorry, we're here now, let's look after Mrs. French, and just move on, and using that as a de-escalation technique to say, yep, sorry, let's get on with it. There's a reluctance to do that though, and I shared this this scenario with some colleagues today that I was teaching, some paramedic colleagues, to get a feel for it from some other practitioners, so it's not just me giving my opinion on this. And we had some interesting discussion around it in today's session. And some of the group were very keen to point out why they would have been delayed, and the categorization of the calls and life-threatening emergencies and so on, and basically put the blame for that delay on the organisation. And the reason that they felt that they had to do that was because they wanted to deflect the anger or the upset from the patient to the organisation and away from them. And we had a discussion around that area, and actually thinking that's helpful for that paramedic at that time to do that, but it's not helpful in the bigger picture, and it doesn't actually make that much difference to the patient or the patient's relatives to be told why it's happened. At that stage, in this type of situation, an apology is enough. And when we started to develop that discussion, we started to look at the potential ramifications of an apology, and this is where it became a bit more interesting, with the perception of an apology meaning that you're accepting responsibility and you're saying, yes, I'm at fault, which is why I'm apologizing. And that is definitely a cultural thing within paramedic practice at the moment, for a certain proportion of practitioners to think that any apology means an admission of guilt and that they've done something wrong. Whereas actually, from a duty of candour perspective, you're just saying sorry. You're acknowledging that the patient has had an experience that is less than ideal from their perspective, and it's an acknowledgement of that rather than any apportioning of blame. And I think that's something that's going to take a while to filter through to the front line and get down to your practitioners that are dealing with patients day to day in this type of situation, to be comfortable with apologising and not thinking that it's going to have ramifications from a blame perspective.
I think that's really interesting, Vince, because I always reflect when I'm standing in a queue in a supermarket and there's a big long queue, and I get to the front of the till and the person on the till says, "I'm sorry to have kept you waiting." And they leave it at that. They don't say, "I'm sorry to have kept you waiting. We're really short of staff today because the management have taken 10 people off the floor." They say, "I'm sorry to have kept you waiting." And instantly I feel, oh, that's okay. You've apologised, and it dissipates some of my crossness. So I think it's really interesting, isn't it? Not feeling that we need to justify that apology and not take the blame for it or dissipate the blame to somebody else. It's just a human response to say, "I'm sorry," isn't it?
Yeah, and you're absolutely right. No, now you mentioned the queuing at the supermarket. I've experienced exactly that, and you're right. You have been waiting a little while, but it's not a problem because they've said sorry. They don't need to explain it. And it's definitely a cultural thing, again, within my profession, that there's a feeling that sometimes means that you're going to get blamed for it, and therefore don't really want to go straight in and apologise without saying why, because that justifies the situation. But it's not necessary, and I think that's it, the not necessary bit is the bit that is challenging for paramedics in particular. Yeah.
Thank you, Vince. That's brilliant. So I'm going to pause now because Vince has said some really important things. I was wondering, Kelly, if there are any questions coming in that either myself or Vince need to answer at the moment.
No, everyone is being very quiet at the moment. Obviously, they have been listening. So we'd encourage you, if you've got questions, to pop them into the chat box.
Okay.
We will have another moment, I know, later in the slides to visit questions. So do pop them in.
Lovely, thank you. So thanks, Vince, for that one. And I'm going to do the next case study, and then we're lucky enough to have Grace who'll do a case study as well. So a few case studies with this one. Now, I've mentioned before to you our COVID stories on the HCPC website, and this is a sort of a collage of our HCP stories. And I thought I'd share with you one of my COVID stories, and it's about a wrong COVID blood result. So I work in one of my roles, I work in occupational health doing contact tracing for staff when they get their COVID swab. So they have their COVID swab. The next day their result comes in onto the computer and it's either negative or positive, and we then let them know. If it's a negative result, we send them an email and a text message, and if it's a positive result, we phone them up because we need to do things like contact tracing, work out when they can return to work and actually see how they are. So that was my job in the morning. I carried on regardless, got through it, and I looked up a result, saw it was negative for a lady I was looked up, and actually sent her an email. and a text message. So that was all absolutely normal. Later that morning, I saw her name was in the inbox and sort of connected the two and thought, oh, I wonder what that's about. And it said, a little message in the inbox said, the staff member doesn't feel well, just wanted to talk to you about what she should do. So I went back into her record because I couldn't remember what her COVID result was. You know what it's like as a healthcare worker. Once you've done one thing, it puts away and you can't remember. So I looked it up, and actually, when I looked it up the second time, I realised that actually her result was positive. What I'd done was I'd looked up a result that was just dated December last year that was negative, and I'd given her that result, and I hadn't noticed that actually she'd had a result. Yes, she'd had a blood test, a PCR test the day before, and actually it was positive. So I'd given her the wrong result. I told her that she was negative rather than positive. And that's a really serious thing to do, as you would all be aware, because there's many public health ramifications, but also personal ramifications for the lady. So I took a moment to compose myself, and because I felt, I don't know, most people on this call would have made a mistake in their life, and it's a really awful feeling. You feel physically sick, don't you? And I thought I need to phone this lady up straight away to let her know what's happened. So I phoned her up and I started the conversation with, I'm really sorry, I sent you an email earlier that was negative, and actually your COVID result, I've just rechecked it and it's actually positive. And I explained that I'd looked up the wrong result basically. She actually was okay. She said, I thought it was a bit strange because the reason I phoned you up was because I don't feel very well. I've got all the symptoms and I thought it was a bit strange when it came back negative. And actually, she was absolutely fine about it. I was mortified that I'd made a mistake, but aware that these things happen, and it was about how I handled it. So I'd already apologised to her. I'd already told her her result. We had a long conversation, but then I followed that up with obviously an email explaining what I'd done, giving her the true result. And luckily she hadn't done anything like gone out or been away from her home, so there was no sort of public health risk. But nevertheless, I felt pretty terrible. And it was then the next step was to go and see my manager and talk to her about what we were going to do, because obviously if I can make this mistake, then somebody else can as well. So we then had to fill in an incident form. So we filled in a Datex form, and we also sort of looked at why I'd made that mistake and how easy it was to make that mistake. And we put in processes to prevent it happening again, and had to write that also on the incident management report. Now, it was a really horrible experience, but actually, it taught me, again, it reinforced the importance to me of being open and honest when things go wrong, documenting what had happened, and also following that up to make sure that it didn't happen to somebody else, that somebody else wasn't in the same situation as I was, really. And interestingly, I noticed that last week there was that awful thing where lots of Amazon workers were given the wrong results of their COVID tests as well. So this is something that can happen. So I thought it was a real interesting one about being open and honest, because it would have been easy for me not to told anybody. It would have been very easy for me to deal with it with the lady and actually not do the next steps, were to speak to my manager and work out systems and fill in an incident management form. And the final step for me was about, I'm revalidating in a few months' time, and I obviously, like you, have to write reflective pieces. So I use this as one of my reflective pieces for my revalidation, to look at, you know, how I'd felt about it, how awful I'd felt, and some of the learning that had happened. So that's my duty of candour scenario. So what we'll do now, I think, is move to the next slide I was going to put up, because I thought I came across these factors that discourage candour, because for me, as I said, I needn't have told anybody. And I look at those list of things, and I'm going to ask Vince in a minute which resonate with him, but the big thing that resonates with me in this situation was a fear of being criticised or judged by my colleagues. I'd been out of nursing for quite a long time. I'd recently come back, and actually the thought that they might think I was absolutely hopeless at my job and that I'd got something wrong and that I was judged as being really not very good at the job was actually a really unpleasant thing. And the other thing that was quite a big deciding, you know, a big factor in discouraging, I think, if I had just been discouraged in being open and honest, was the fact that I had to annoy my boss, who was already very busy, and tell her what I'd done, and that ramifications of that took time. So that was for me. And I just wondered, Vince, which ones resonate with you?
Yeah, I think it's very similar to yourself in the one about the colleagues is one that actually is more pertinent, and thinking that what your colleagues will think of you. And I also go for the blame culture, but not that that exists, but there's a perception of it existing, and I think that's something that's a throwback to previous years where there was that culture. So you're reluctant to say anything because you're going to get in trouble, and that is disappearing, but there's still a feeling that it's there. But I wouldn't think annoying senior colleagues would bother a paramedic. They'd be quite happy to annoy senior colleagues. Why wouldn't they? But I think being judged by colleagues in the blame culture would be where I would go with that one.
Thank you, Vince. Thank you. Very honest. Thank you very much. OK, so I'm going to put up the next case study, which is one that I think Grace is kindly going to look at. So I'll just pause for a second while you read that one, if that's all right, Grace. We've met Addy before, actually, and we met Mr. Anand before in one of our webinars in the past, who has motor neuron disease. So this is a slightly different one. There we go, Grace. So he's been prescribed the wrong type of thickening. It's thickening like what's it called? It's thickening stuff that you put into people's food and drink to make it easier to swallow. So similar concept, isn't it, Grace? So I was just wondering what you would recommend a registrant to do in this situation.
Yeah, thanks, Kim. So I suppose from the outset, I just want it's worth noting that, we get a lot of queries like this from registrants, and I want to note from the outset that things go wrong, and we understand that things go wrong. It's completely natural, as both you and Vince have been discussing. I guess the important thing from our perspective is that when things do go wrong, registrants acknowledge that, and they're open and honest about this, and it's important because that enables people to rectify the problem and also to prevent it from happening again. So I suppose in this particular scenario, the issue may not cause the patient any harm, but as per our standards, professionals have a responsibility to be open and honest when something's gone wrong, irrespective of the level of harm caused. So from the outset, in this scenario, I'd advise the professional that they'd need to admit to or inform the service user of the mistake and apologise for the mix-up. From our experience and from research, being open and honest about mistakes is one of the best ways to resolve an issue and receive feedback. And it's also really important to maintain trust of the public. If a service user can be assured that you're open and honest with them, then they're more likely to continue to trust you, and it could hopefully prevent the situation escalating further again. So that's really important, clearly explaining what happened, the effects that it might have, and yeah, remembering to apologise there. Another important thing would be that you should talk to your manager or employer, make sure that you follow any employer policies for when a mistake happens. Your employer will likely have a procedure in place that you'll be required to report to. And also, I think talking to your manager or employer, that will probably lessen the burden, and they'll be able to point you in the right direction and provide you with any support that you need. I think also, after admitting to the issue, it's important to actually seek to resolve the issue and put matters right. So again, you might want to seek wider support from your manager or employer in order to identify the most appropriate solution to this. I'd also advise that we haven't discussed this in our seminars yet, but as per Standard 10, registrants should be keeping accurate records of work. So we'd also advise registrants to record the error, including what they've done to notify the service user of the issue and what else you've done to make your decision on how to rectify the issue. You may also, as well as recording it, raise this via an incident reporting system, such as Datex as well.
I think that's great, Grace. Thank you. And I love the fact that you're linking it to trust. It's about this trusting relationship, isn't it, between you and your patients. Patients will trust us much more if they think that we're going to be open and honest and we explain why things have happened. Yeah,
exactly.
Yeah, thank you, Grace. And I'm going to pause there for a second and see if we've got any questions, if that's all right. We might not have any questions, but see if we've got any questions coming in, Kelly.
So thank you, Kim. Very light on questions again this evening. So people are obviously listening intently and not got the opportunity really to pop questions in. We do have an observation from somebody that I think is worth a read. They're anonymous, I can't let you know who they are, unfortunately, but their observation is that to defend is so normalised and habitual in our culture, and it drops out and sort of lands with without any cognitive thought. And they say to pause and to pause that response and simply apologise with no ifs and buts is so powerfully de-escalating. And they say thank you, Vince. So thank you for that, Vince. It's obviously hit home with some people there. And I wondered whether, just to encourage a little bit of engagement so that we know that there's a massive audience out there listening to us, perhaps people wanted to just pop into the chat box some of the things that they feel discourage candour for them. We had the slide just a minute ago, and obviously Kim and Vince have told us what it is that makes them, you know, resonated with them in terms of not wanting to be open and candid. So perhaps if people wanted to try and just start sharing some of their thoughts, you're welcome to remain anonymous. You don't have to identify yourself with your name in the chat box. Thank you.
Brilliant. Thank you, Kelly. That's brilliant. And I love that comment about pausing and the power of pausing and using those words. That was really, really nice. OK, so I think we've made this point that an apology is so important. It's so fundamental. And Vince already said, didn't he, that the HCPC doesn't regard an apology of itself as admission of liability or wrongdoing. That's not just the HCPC, that's many other organisations as well. And I'm particularly going to signpost you to a really good document called Saying Sorry by NHS Resolution. It's just four pages, and it really sort of summarises what saying sorry is about. It says it's always the right thing to do. As we said, it's not an admission of liability, but it does acknowledge that something could have been done better, and that's okay to acknowledge that. And I've talked a little bit about the learning from my duty of candour, my mistake that happened, and the importance of this closing the loop, preventing it reoccurring is so fundamental in healthcare, isn't it, really? And unless we do that, then nothing's actually going to improve, isn't it, really? And my next slide is a really good set of examples, because we've already started talking about words that you can use, because we do sometimes stumble on these I'm sorry words. This document has some really good stuff on that, and it makes some suggestions for you. So I thought I'd share those suggestions that they recommend, because I thought they were really nice. And it talks about not saying things like I'm sorry you feel like that, because what it does is it implies sort of fault, really. It's not saying, you know, it's adding a little bit on, which is implying that there's some sort of, you know, that the patient's fault because they feel like that. And we're sorry if you're offended. That word if is a bit of a concern, isn't it, really? It makes the patient feel like they shouldn't be offended, and as if there's any doubt, really. I'm sorry you took it that way is quite condescending, isn't it, really? You know, implies that somebody else wouldn't have taken it that way. It's only because they're who they are that they've taken it that way. And we're really sorry, but. So the if and but word are really not very helpful at all. And then they suggest that you're quite specific. So I'm sorry that there was a delay in the ambulance coming to pick up Mrs. French, your wife. I'm sorry about that. I'm truly sorry for the distress caused by me giving you the wrong COVID test result. And I'm sorry that we've learnt that. And that would be a really important follow-up, particularly for me. We ummed and ahed about phoning the patient back later on that day to talk to her about what we put in place, because she was a staff member. So we actually sent a little email later on that day, and actually said what we'd done, and we'd filled an incident report just so that she was assured that we'd followed it up, really. Because I'm sorry that we've learnt that is really important. It's, again, taking it on to that next level, isn't it? And I just wondered, Vince, if you've got anything to add to those words at all. Put you on the spot, sorry.
No, I think it's very easy to do the don't say ones there. I think that's the change. It's so much easier, because what you're doing is you're effectively not sorry. You're sorry. Well, you're not sorry. And that's what you're kind of saying you are, but then you're immediately taking it back by putting it down that any reasonable person wouldn't be expecting an apology. It's the sort of situation where you've been told by your line manager you have to apologise to a colleague. That type of thing, where actually you don't feel you have to apologise, so you'll caveat it with if you feel that way and so on, and that's not appropriate in the context that we're talking about for dealing with patients and errors and where things have gone wrong. It's not going to be the patient's fault. You don't have to qualify it or quantify it at all. Just be sorry, and as our comment said, stop and just pause.
Yeah, that's really nice. Thank you, Vince. I love that. That's really, really helpful. Yeah, so those words are quite useful, I think, and I certainly found them very useful when I was thinking about duty of candour and thinking about apologies and keeping it simple. I think that's where we're coming down with, isn't it, really? So the second part of duty of being open, standard 8, is about dealing with concerns and complaints. And I just thought I'd float a couple of things to you because it's just really useful to know some organisations that might be useful to you. I think we know about quite a lot of organisations we can complain to, but just wanted to point out a couple. For those of you who are working in hospitals or working around hospitals, there's the Patient Advice Liaison Service in most hospital trusts, well, in all hospital trusts. Right in the foyer is the PAL service as we know it. There is organisations like Health Watch. There are citizens' advice. There's many organisations about how to complain to the NHS, but I thought I'd signpost Health Watch because they are a voluntary statutory organisation that might be quite useful. And we have a customer feedback at the HCPC, as all organisations do, so that if you want to send something in to us, if you've got concerns about something we've done, then you can also do that as well. So in summary, really, I just want to summarise the whole of the conversation today. We've really looked at openness and honesty, and Vince has talked about the importance of that, not only in the paramedic profession, but actually in all professions. So we've talked about the duty of candour, talked about the importance of the professional duty of candour, but there is also the statutory duty of candour. We've talked about saying sorry and the really importance of that, but the difficulties that we have as healthcare professionals for saying sorry because of things like litigation, blame, those sort of issues. And the most important thing for me is we've talked about learning and reflection. So what happens after you've said sorry? What happens after something happens? How do we learn from that mistake that's happened, and how can we prevent something like that happening again? So I'm going to pause for a second to see if there's any questions, Kelly, or have we got lots of no questions or any comments?
No, lots of activity now. So we've got lots of thoughts around the sort of barriers, really, the things that discourage, and they are very similar to resonating people. It is that fear, blame, feeling of blame, that they still, some people who are feeling that they are within blame cultures, and so there is that fear. And the colleagues and staff, there's some people who are commenting now about wanting the way to apologise and taking the responsibility for apologising. So some good stuff there. We've been posting them so everyone can have a look at them. I do have on Slido a very good question that I don't know if we'll have the answer to, but I'll put it out there and we can certainly try. And that's, is there strong evidence that being open and honest leads to increased trust?
There is strong evidence. There's strong evidence that being open and honest leads to a reduction in complaints. That's totally evidence.
So the duty of candour. Yeah, I was going to say the duty of candour. I mean, I think whether there's a research document that we could point to, I'm not aware of one that I could point to. I don't know if Vince or Grace are either, but I think the duty of candour came about from the mid-staff's stuff. So all of the failings around the mid-Stafford's trust, and one of the biggest concerns there was the feelings with patients and not being informed when something had gone wrong, and the impact that had on them, the impact that it had not only on them not losing that trust and confidence in their local healthcare provider, but also that taking away their ability to put things right themselves, to maybe go on to seek other care, to come back, to have different treatments or different options made available to them. So whilst I'm not sure if I could point to a research document, I think it's those inquiries and those that look very deeply into those big scale failings in healthcare are the things that I would probably point to say that's where the evidence is perhaps set out.
Francis report, yeah, definitely.
Feel free, anyone, to give any more thoughts on that.
Yeah, if anybody's got any answers in chat, do link us to a couple of articles or anything, but I'd agree it's those big reports, the Francis report, the Freedom to Speak Up report, which we've talked about before. Yeah, they're really important. And talking about Francis report and Freedom to Speak Up, I was just going to signpost you quickly to the National Guardian Freedom to Speak Up. We've talked a lot about the Guardians, but last week they had a new e-learning module package that they've done in partnership with HEE called the Freedom to Speak Up in Healthcare England programme that's available on e-learning for health. And I just wanted to point that out to you because I thought it might be really, really useful to everybody. Again, a bit of a push for our diversity data survey. We've mentioned this before, but if you could possibly do your emails about your diversity data, that would be really super helpful, because we do need that data to help give you more information, really. I mentioned earlier that our employer newsletter is coming out in the next couple of days. If you haven't subscribed, please subscribe, and then we'll send you one in the next couple of days with lots of really useful information, facts and figures in it. So that might be really useful to you. And our student hub that we keep plugging, but it is really getting lots of traffic. We're getting lots of students looking at our student hub. So that's another really good resource for students amongst you, or student teachers amongst you. And our next webinar is on the 24th of March at 1 o'clock. We changed the times of these to find out what's most popular to you. And that's all about honesty and trustworthiness. So it really builds on that openness session that we've done today. It really builds on that, really. So this is what we've looked at today. We've looked at Standard 8, and I'm going to go to Slido now and just ask you another couple of questions, exactly like we do at the end of every session, here we go, for some questions for you. So after this session, you now know that Standard 8 is about being open. How would you rate your understanding of Standard 8? That should be coming up soon to see what people say and how it differs from the earlier responses that we had for you. That won't be too long at all to take those. I know you can only see 3 on the screen, but I can see lots more than that. So that's actually quite useful. So I apologise for the fact it does take a little bit of time, but that's been really useful. Lovely. And my next question is, now when you think of the HCPC, what word comes to mind? A bit of typing for everybody to see what they say. And I must say that I've really enjoyed hearing from Vince about his experiences. They've been really helpful, Vince. So thank you very much for your time this evening. We'll say thank you properly in a moment, but it was really useful to hear about your experiences and your thoughts about the difficulties for saying sorry and the complications that has. Particularly, I hadn't actually thought the fact that because you see the patient for such a short period of time, if something goes wrong with the rest of their care and that there is an element of an issue within the paramedic sphere, that it's really difficult to find out what goes on, really, and it might be really difficult for you to find out what goes on. So thank you for those words. That's really helpful. And my last couple of questions is, how likely are you to recommend this training to your colleagues? So thank you very much for this. Oh, that's always a nice thing to see. Thank you very much for that. Again, it's come through a lot more on my screen than yours, so I do apologise for that. And my last 2 questions are, has this session helped you reflect on your practice? Yes or no? A very quick one. Very quick one. Doesn't take long to vote with these quick ones, does it really? It's quite easy to do. It's lovely. And my last one before we finish and before we wrap it up here, has your knowledge of the HCPC improved? Yes or no, or it was already good? So that's really useful as well. Okay, thank you for that. Thank you very much. That's really helpful. So that's how you get in contact with us. The usual mechanisms. If you ever want to email us, you're very welcome to. But I want to do a few thank yous because I have my usual thank you slide, but we've got some real big thank yous to say today. So Vince, thanks so much for joining us and your reflections on today. Is there anything you want to, it's been super of you to give up your hour and talk to us, but is there anything you wanted to add, Vince? As your last thoughts?
No, I don't think so. I think we've captured everything that we were hoping to from my perspective. So I'm quite happy with that. Thank you for inviting me.
No, it's an absolute pleasure, Vince. Come back again. That would be very helpful. And Grace and Holly and Kelly, is there anything else you want to add? Kelly, is there any other questions or any other issues that are coming up that we might like to just finish on?
No, again, people have been posting lots of their thoughts and stuff, which is really brilliant. And thank you everyone for sharing those. We do have someone who's just asked us to sort of run through the duty of candour again. So I think in response to that, I just would point out that we are recording this. We will upload it and we will send you the link. So if we've gone a little bit too fast through any of it at the earlier slides, you'll be able to watch it at a slower pace and at your leisure. So please do that.
Yeah.
Thank you.
Thank you. Well, thank you very much. Grace, have you got anything to add at all?
No, not from my perspective.
Lovely. Okay, well, as usual, a massive thank you for everything you're all doing in the pandemic and supporting everything that you do in healthcare. It really, really is appreciated. And we will see you at the next webinar, which is looking at Standard 9, which is honesty. So see you then towards the end of March. Take care. Bye-bye.